She'd been serving mashed potatoes and green beans for 2 years, invisible to everyone in scrubs who hurried past her station. But when the trauma bay filled with victims from a 5-car pileup and no surgeon could be found, Maya Rodriguez put down her serving spoon, walked into operating room 3, and performed a craniotomy that saved 3 lives, with techniques she wasn't supposed to know. Welcome to Hidden Legends. Before we begin this powerful story of courage, skill, and forgotten heroism, tell me in the comments where you're watching from today. And if you believe stories like this need to be heard, hit that subscribe button and help us make sure they are. Maya Rodriguez had perfected the art of being forgettable. For 2 years, she'd stood behind the steam tables at Metropolitan Medical Center's cafeteria, ladling food onto trays with the mechanical precision of someone who'd learned to disappear into routine. At 36, she wore the same navy blue uniform every day, hair pulled back in a simple ponytail, speaking only when spoken to and keeping her eyes down when doctors and nurses rushed past during their brief lunch breaks. To the medical staff, she was just another cafeteria worker, polite, efficient, invisible. They didn't notice the way she listened when they discussed cases over their hurried meals. They didn't see how her hands sometimes trembled when trauma codes echoed through the hospital speakers. And they certainly didn't know that Maya Rodriguez had once been Dr. Maya Vasquez, one of the youngest neurosurgeons ever to complete residency at Johns Hopkins, before a malpractice lawsuit destroyed her career and sent her into hiding. The lawsuit had been fabricated, a wealthy family covering up their son's drunk driving incident by blaming the surgeon who'd tried to save him. But by the time Maya's name was cleared, the damage was done. Medical boards whispered, hospital administrators hesitated, insurance companies balked. The career she'd sacrificed everything for had vanished overnight, leaving her with student debt, legal bills, and a medical license she couldn't use. So she'd moved across the country, changed her last name, and found work where no one asked about her past. The cafeteria job at Metropolitan Medical was supposed to be temporary, just until she figured out how to rebuild her life. 2 years later, she was still serving lunch to the doctors she'd once called colleagues, watching them save lives with techniques she'd taught herself to forget, until the afternoon when forgetting became impossible. Tuesday, October 15th, started like every other day. Maya arrived at 5:30 a.m. to prep vegetables, checked inventory, and set up the breakfast service. The cafeteria filled with the usual morning rush, tired residents grabbing coffee, night shift nurses eating before heading home, administrators starting their day with yogurt and granola. Dr. Jennifer Hassan, head of trauma surgery, stopped by Maya's station during the lunch rush. She was a woman in her 50s with gray-streaked hair and the confident manner of someone who'd spent decades making life-or-death decisions. "Could I get extra vegetables today?" Dr. Hassan asked, holding out her tray. Maya nodded and served the usual portion, but something made her pause. Dr. Hassan looked exhausted, more than usual. Dark circles under her eyes, slight tremor in her hands. "Long surgery?" Maya asked quietly, surprising herself by speaking. Dr. Hassan looked up as if noticing Maya for the first time in 2 years. 18 hours. Complex brain trauma from a motorcycle accident. Touch and go for a while, but we managed to reduce the intracranial pressure and stabilize him. Maya's hand tightened on the serving spoon. Those were technical terms most cafeteria workers wouldn't understand. "That sounds challenging," she said carefully. It was. We had to perform a decompressive craniectomy, and the bleeding in the temporal lobe required microsurgery to repair the damaged vessels. Maya nodded, fighting the urge to ask about surgical approach, post-operative monitoring protocols, or the patient's Glasgow coma scale scores. Instead, she just said, "I hope he recovers well." Dr. Hassan studied Maya's face for a moment, something curious in her expression. But before she could respond, the trauma alarm echoed through the hospital. Level 1 trauma incoming, multiple casualties, ETA 8 minutes, all available staff to trauma bay. Dr. Hassan's tray clattered onto the counter as she ran toward the elevators, leaving Maya alone with the knowledge that somewhere in the city, people were fighting for their lives. The first ambulance arrived at 2:47 p.m., followed by 3 more in rapid succession. From the cafeteria windows, Maya could see the organized chaos of trauma response. Paramedics wheeling gurneys toward the emergency entrance, helicopters landing on the hospital roof, staff running with the urgent purpose of people racing against time. The 5-car pileup on Interstate 90 had started when a semi-truck's brakes failed during rush-hour traffic. The details filtered through the hospital's communication system: 7 critical patients, multiple head injuries, 2 with suspected brain trauma requiring immediate surgical intervention. Maya continued serving lunch, but her attention was on the trauma codes echoing through the hospital speakers. She recognized the medical terminology, understood the urgency behind each announcement. Despite herself, she found her hands moving automatically while her mind processed the information flowing past her station. "We need Dr. Hassan in OR 3, stat. Patient in trauma 2 shows signs of increasing intracranial pressure. Where's Dr. Morrison? We need neurosurgery now." Maya's movements slowed as she realized what was happening. The hospital's neurosurgical team was being overwhelmed. Dr. Hassan was already in surgery with the motorcycle victim from the night before. Dr. Morrison, the second neurosurgeon, was at a conference in Chicago. The third member of the team, Dr. Patel, was on vacation. At 3:15 p.m., the announcement that changed everything came over the speakers. "Code Blue, Operating Room 3. Code Blue, Operating Room 3. Maya set down her serving spoon and walked to the cafeteria's back office, where she could hear the emergency communications more clearly. Through the static, she caught fragments of the crisis. Dr. Hassan had collapsed during surgery. Exhaustion from the 18-hour procedure had finally caught up with her. She was stable but unconscious, leaving a patient with an open skull and active brain bleeding on the operating table. The trauma patient, a 23-year-old construction worker named David Park, was dying. Without immediate surgical intervention to stop the bleeding and reduce brain swelling, he had minutes before irreversible brain damage set in. Maya heard the desperate calls for any available neurosurgeon, the frantic attempts to contact off-duty staff, the growing realization that no qualified surgeon could reach the hospital in time. That's when Maya Rodriguez, cafeteria worker, walked out of the kitchen and toward the elevators. Maya had never intended to enter an operating room again. For 2 years, she'd told herself that part of her life was over, that the skills she'd spent a decade developing were better left buried. But standing outside Operating Room 3, listening to the chaos inside, she couldn't ignore what she knew. David Park was going to die if someone didn't act in the next 10 minutes. The OR was in controlled panic when Maya entered. Nurses maintained the surgical field while an anesthesiologist monitored vital signs. The patient's brain was exposed, blood pooling faster than suction could clear it. Without a surgeon to identify and seal the bleeding vessels, time was running out. "Who are you?" demanded Dr. Lisa Chen, the surgical nurse managing the crisis. "This is a sterile environment." "I'm Maya Rodriguez," she said calmly, moving toward the scrub station. "I need to operate on this patient." "You're the cafeteria worker. Are you insane? Security." But Maya was already scrubbing in, her hands following procedures she'd performed thousands of times. "Dr. Chen, that patient has a middle cerebral artery rupture with associated temporal lobe hematoma. Without immediate microsurgical repair, he'll be dead in 8 minutes. The specific medical terminology stopped Dr. Chen mid-protest. "How do you know that?" "Because I can see the bleeding pattern from here, and I know what a torn MCA looks like." Maya finished scrubbing and moved toward the gown station. "I also know that every second we spend talking is brain tissue dying." Dr. Chen looked at the monitors showing David's deteriorating condition, then at Maya's confident movements as she prepared for surgery. Something in Maya's manner, the way she moved, the precision of her terminology, the calm authority in her voice, made the decision for her. "If you're not a surgeon, this is murder, Doctor," Chen said quietly. "If I don't operate, it's definitely murder," Maya replied, stepping to the operating table. Maya looked down at the exposed brain tissue and felt 24 months of suppressed instincts surge back to life. The familiar weight of the surgical instruments, the controlled environment of the OR, the absolute focus required to work inside the human brain, it all came flooding back, as if no time had passed. "Microscope down," she said calmly, and the surgical microscope descended into position. Through the eyepieces, Maya could see the damage clearly. A torn middle cerebral artery bleeding into the temporal lobe, with developing edema that would soon compress vital brain structures. "I need micro-scissors, bipolar forceps, and gel foam," she said, extending her hand. Dr. Chen hesitated for only a moment before placing the instruments in Maya's palm. Working with the precision of a watchmaker, Maya began the delicate process of controlling the bleeding. Using microsurgical techniques, she carefully dissected through brain tissue to reach the torn artery. Each movement was deliberate, controlled, avoiding damage to surrounding neural pathways that controlled speech, memory, and motor function. "Pressure's dropping," announced the anesthesiologist. "We're losing him." "Not today," Maya said quietly, using the bipolar forceps to cauterize the bleeding vessel. The hemorrhaging slowed, then stopped. Suction clear. With the bleeding controlled, Maya turned her attention to the hematoma, the blood clot pressing against David's brain. Using gentle irrigation and suction, she removed the clot while preserving healthy brain tissue. "How is this possible?" whispered Dr. Chen, watching Maya work with techniques that took years to master. "ICP is stabilizing," reported the anesthesiologist. "Vitals are improving." Maya continued working, repairing damaged blood vessels and ensuring no additional bleeding sources remained. The surgery required the kind of microsurgical skill that only came from hundreds of similar procedures, experience no cafeteria worker should possess. 43 minutes after she had entered the operating room, Maya completed the final sutures and stepped back from the table. "Close when you're ready," she told Dr. Chen. "He should make a full recovery with proper post-operative care." David Park's surgery was a complete success. Within 6 hours, he was awake, responsive, and showing no signs of neurological damage. The microsurgical repair had been flawless, the work of a master neurosurgeon at the top of their field. Dr. Chen found Maya in the cafeteria the next morning, standing behind the steam tables as if nothing had happened. "Who are you really?" Dr. Chen asked quietly. Maya continued serving breakfast, not looking up. "I'm Maya Rodriguez. I work in the cafeteria." Maya Rodriguez didn't perform that surgery. That was the work of someone with years of neurosurgical training, someone who's done hundreds of craniotomies. Maya finally met Dr. Chen's eyes. "Sometimes people aren't who they seem to be." Dr. Chen sat down at a nearby table, ignoring the breakfast tray in her hands. "I looked you up. No medical training, no surgical background, hired 2 years ago with basic food service experience. But yesterday I watched you perform microsurgery that would challenge some of our best residents." Maya said nothing, returning to her work. "Dr. Hassan is asking to see you," Dr. Chen continued. "She's recovered fully, and she wants to know who saved her patient." "I'm sure she'll find out," Maya said. That afternoon, Dr. Hassan approached Maya's station during the lunch rush. She ordered the usual, grilled chicken, vegetables, and rice, but didn't move away after receiving her tray. "I heard what you did yesterday," Dr. Hassan said. "I also heard how you did it." Maya kept her eyes down. "I don't know what you mean." Maya Rodriguez, cafeteria worker, somehow knew advanced neurosurgical techniques. Maya Rodriguez somehow had the steady hands and precise knowledge to save a life that I couldn't save myself. Dr. Hassan paused. "But I don't think your name is really Maya Rodriguez." Maya's hands stilled on the serving utensils. "I think your name is Dr. Maya Vasquez, and I think you graduated from Johns Hopkins 15 years ago as one of the youngest neurosurgical residents in the program's history." The cafeteria noise seemed to fade around them. "I also think," Dr. Hassan continued, "that you're the surgeon who was wrongfully accused of malpractice 3 years ago in the Marcus Webb case, the case that was later proven to be insurance fraud." Maya looked up for the first time, meeting Dr. Hassan's eyes directly. "The question is," Dr. Hassan said, What are you doing serving mashed potatoes when you should be saving lives? 3 hours later, Maya sat in Dr. Hassan's office, telling her story for the first time in 2 years. The lawsuit, the destroyed reputation, the impossible choice between fighting a legal battle she couldn't afford and disappearing into a life where no one asked questions. "The medical board cleared you 8 months ago," Dr. Hassan said. "The insurance company settled. Your license is active and unrestricted." "That doesn't mean anyone will hire me," Maya replied. Dr. Hassan smiled. "I'm hiring you. Our neurosurgical department needs someone with your skills, and after yesterday's demonstration, I'd be insane to let you serve lunch for one more day." "Dr. Hassan, I haven't practiced in 3 years. I'm not ready to—" "You saved a life yesterday with no preparation, no team support, and no advance notice. If that's what you can do cold, I want to see what you can do when you're ready." 6 months later, Dr. Maya Vasquez was back where she belonged, in operating room 3, performing the complex neurosurgeries that had once defined her life. David Park, fully recovered, attended her first surgery as a gallery observer, wanting to meet the woman who'd given him a second chance at life. Maya kept the cafeteria job for 2 weeks after accepting the surgical position, serving lunch to her new colleagues and watching their amazement as they slowly realized who she really was. Sometimes the best hiding place for a surgeon is behind a serving spoon, invisible in plain sight, until the moment when everything you know becomes necessary to save a life. Some people serve food, others serve medicine. Maya Rodriguez had learned to do both, but Dr. Maya Vasquez was always meant to serve in an operating room, where steady hands and precise knowledge could mean the difference between life and death. This story was brought to you by Hidden Legends. Heroes walk among us in every profession, often disguised as ordinary workers, ready to use extraordinary skills when someone's life depends on it.